All right, my patient's had the Foley catheter for 3 days, and the doctor's written an order to discontinue Foley catheter. So I'm going to, since this is check-off, I'm going to tell you that I'm going to check the order to ensure we have a discharged Foley catheter order. I'm going to do my hand cleaning with the hand sanitizer or wash my hands with soap and water before I go in the room. I'm going to ensure adequate lighting. I will tell the patient, introduce myself, I'm Jim, I'm your nurse. The doctor wrote an order to discontinue Foley catheter. Now, if I've been taking care of this patient, of course, all day, I don't have to introduce myself every single time I go in the room. That would be foolish. But for check-offs, you've always got to do that because it's check-off, and this is the first time you've seen the patient. So anyway, I'm going to check a wristband, and I am going to tell the patient what we're doing. The doctor wrote an order to discontinue the Foley catheter, so I get to take it out. They will usually be pretty happy about that. I'm going to get my gloves. These are non-sterile. Non-sterile latex-free gloves. I'm going to ensure privacy. And don't just say I'm going to ensure privacy. I would actually close the curtain because, you know, there's some things you shouldn't be simulating. When you're doing these procedures, you should do the whole procedure, because if you just kind of fly through it halfway, the things you're just flying through you will miss on check-off, because check-offs are kind of intimidating to new people. So we are going to discontinue Foley catheter. I'm going to have the patient get back in the position. Got a towel so that we don't make a mess on the linens, because there will be some dribbling usually. And now we're ready. Sometimes people say you should empty the Foley catheter bag before. It really doesn't matter. You can empty it after, just so long as it gets emptied and documented in the eyes and nose. If a patient's got a Foley catheter, they're going to want to know how much output there is, or they wouldn't have a Foley catheter. Okay. Now, you can also check the charting, because generally the charting will say 10 cc's in the balloon, because that's what the balloons normally are. A lot of times they will also have written here 16 French, 10 mil. So I know that this should have 10 mils in it. The other way you can make sure you've got everything out is pull until you have negative pressure. And you can sometimes see the catheter itself caving in when you have high negative pressure. So I got 10 out, and now I'm going to tell the patient, take a deep breath in and blow out. And when they're blowing out, I'm going to pull the catheter out. Wrap it up in the towel. You may have to block them off a little bit. And then we will let them get back into a more comfortable position. Now we'll take this to the restroom to empty and document. We'll talk about documentation in a moment when I get over to the chart.